Hello, good afternoon, good evening, and good morning to everyone joining our today's session on COVID-19 Ask WHO. Actually, Ask Dr. Maria van Kerkhove today. We have a little bit different week than usual because our executive board is meeting here in Geneva. So we have had to change our date and time for this session, and we have Maria only today, but thank you, Maria, for finding the time. I know this is really busy as there's a lot of conversations going on COVID and other emergencies at the moment.
Well, thanks for having me.
Before the executive board met, I know all these terms may confuse some of our viewers, but we had our regular meeting of emergency committee on COVID-19 that meets every 3 months, and Dr. Tedros accepted their assessment that COVID is still a public health emergency of international concern. So can you please clarify for our viewers what does that mean and what are the recommendations for each and every of us?
Yeah, so thanks, Alex, for having me back. And it is a busy time, but we love doing these. And I think it's an important way to communicate and answer these questions directly. So as you pointed out, the Emergency Committee for COVID-19 did meet just before the EB. And as you say, they meet every 3 months or so to assess the current situation and give the Director General advice on whether the current situation or the COVID situation constitutes a public health emergency of international concern. And it's the Director General who takes the decision of whether or not it does. And he agreed with their assessment, with their advice, that the current situation still constitutes a public health emergency of international concern. But they did note, and he also notes, that we're in sort of a transition period, an inflection point, if you will, because we're in a much better situation than we were 3 years ago, given when this is a new virus and when it was first circulating. And now we have so many tools that can actually reduce the impact of COVID-19 in terms of hospitalizations and deaths. And so it means that we're still in that emergency phase. Now, all countries are in different situations for a variety of reasons, based on their current situation in terms of what variants are circulating, their population level immunity, their access and use of tools, their ability to adjust and surge when there are increases in cases, the way that they have utilized vaccines and have boosted their vulnerable populations. And countries are working very hard right now to manage COVID and to live with COVID responsibly. But we haven't yet reached a phase where we are living with it responsibly and controlling it and managing it like we deal with other diseases. So we're still in that emergency phase. And so there's a lot that needs to be done to get through that. The DG has said many times that he believes, and I agree, that we can end this emergency in all countries this year. We had hoped we could have done it last year, and it was possible, but we didn't quite make that goal. But this year, we can do that.
Thank you, Maria. And I would just like to remind all our viewers, if they're watching us on Twitter, to use the hashtag AskWHO to ask their questions. Sorry, I'm switching between cameras here. If you're watching us on other channels, please use the comment section and I will pass your questions to Maria. Maria, since Dr. Tedros shared what is the outcome of this emergency meeting and the decision that he has made based on their recommendations, we've seen some confusion in social media conversations between what is public health emergency of international concern versus pandemic. What is the difference? So maybe you can help and clarify.
Yeah, we've gotten this question quite a lot during this pandemic, and it is a good question because some of these terms are quite confusing. When we talk about the public health emergency of international concern, that's really an extraordinary event, requiring international collaboration, and we're still in that phase. And we still see incredible impact of COVID-19 in many countries around the world. We've seen an increase in deaths in the last 8 weeks alone. That was even before the surge of Omicron in China recently, where we had more than 170,000 deaths in the last 8 weeks alone across the globe, including those deaths in China. And so ending the emergency phase, ending the public health emergency of international concern is a goal where we get to and we can manage COVID more responsibly. The pandemic is something very different. And I know a lot of times the question of the fake and the pandemic fake is the acronym for public health emergency of international concern, and the pandemic are all often asked at the same time, but they're very different things. This virus is here with us to stay. This pandemic virus is very much here with us to stay, and we're going to have to live with it more responsibly as we go forward. That means living our lives. It means living our lives as safely as possible, getting vaccinated and boosted when it's recommended for us, wearing a mask when you're indoors and when you know you don't have good ventilation, taking measures that reduce your exposure, that reduce your risk of infection, the risk of getting long COVID, the risk of passing the virus to somebody else who is more vulnerable, and also supporting government supporting health systems to maintain surveillance, for clinical care pathways to be strengthened to deal with surges in impact and hospitalizations, making sure that we have access to antivirals in countries. So there's a lot that needs to be done as we manage it going forward. But the pandemic will be with us for a long time, but the emergency of it doesn't have to be. And that's what we're working with all countries to end.
Thank you so much, Maria. Here's a question from Charlene Turner, saying that some medical facilities have lifted their mask requirements for medical staff and office staff. It is exceptionally concerning since my area has moderate community transmission of COVID-19.
So our recommendations are to continue to wear masks when you're around others and in indoor situations. Certainly for health workers, masks or respirators, depending on the situation that they're in, N95s or FFP2s when they're caring for patients, because the virus is circulating around the world pretty much unchecked right now. So we know the case numbers that are reported to us are low, are underestimates. And so the virus is circulating. So masks are part of the comprehensive package to control transmission, to limit the spread, to protect you as an individual. And for health workers, this remains critically important, as well as other personal protective equipment. So our recommendations are still in effect.
Thank you so much, Maria. You mentioned that we've had increase in cases and that. So maybe we can go back to our usual update on epidemiological situation at the moment and where the transmission hotspots are.
Yeah, so I'm switching with looking at my epi update. So we recently revised our weekly epidemiologic update where we're giving monthly periods now, because the data that is reported to us on a weekly basis is very inconsistent across the globe. This is something we're working with all of our member states on to improve, because we still need to be able to track this virus. And we can talk about that when we talk about variants later. But more importantly, we need to be able to track hospitalizations, admissions to ICU, and deaths. And so what we're looking at now is a month-by-month basis. And compared to last month, we've seen a decline in the number of cases reported to us, but that's off the backdrop of a significant drop from China, where we had a very large number of more than 45 million cases reported in a single week across the world, including cases from China. In fact, we had to rescale the epi curve that we regularly show, and almost dwarfed some of the previous waves of infection that we had seen previously. But month by month, we're seeing an increase in deaths. And this is what concerns us. 4 years into a pandemic where we have many safe and effective vaccines, when we have many antivirals and therapeutics that save lives, when we have diagnostics that can get patients into the clinical care pathway, we should not be seeing increases in deaths. And this is part of the challenge. As we manage COVID going forward, we should see that death number, that death decline. And we're not. We're starting to see it increase. So this is what worries us. We see some hot spots around the world in terms of increases in deaths. And what we look at now is the decoupling. We will see waves of infection, but that doesn't have to track with increases in hospitalizations. And some countries are keeping deaths and hospitalizations low. Others are really struggling with that. And the countries that are struggling with increases in deaths are those that are missing populations, that have vulnerable populations, people at risk, over 60, people immunocompromised with underlying conditions, that have not received the full number of vaccine doses. And these are the individuals who are ending up in hospital and who are dying. And so this is what concerns us. 8-9 weeks of increasing deaths is not where we should be 4 years into a pandemic.
Maria, thank you so much. And I'm glad you mentioned the immunocompromised, because we got a question if the measures are lifted or emergency is lifted, what do we do to protect people who are immunocompromised?
Well, that's a great question, because there's so many tools that we have that can protect individuals. And as individuals, you need to know what to do to keep you safe and those around you safe. And it starts with knowing your risk as an individual and knowing the risk of the people who are around you and utilizing different tools. Self-testing if you have access to tests. If you're infected, stay away from others. If you are around others and you are in busy places, you're on public transportation, wear a mask, a well-fitting mask over your nose and mouth. Make sure as much as you can to keep distance from others. And we know that that's not possible in all situations, but where feasible, keep distance, but wear a mask, especially when you're in crowded places. Open windows, make sure that you have good ventilation where you are as best you can. And in workplaces, we need to ensure that workplaces have better ventilation. There's a lot of things that we can do. Among those who are vulnerable, who are in a vulnerable category, an at-risk category, make sure you're vaccinated and especially make sure you're boosted. Our recommendations are that you need to be boosted. Your latest boost should be 4 to 6 months after your last one. And that recommendation, follow your national guidelines, but make sure that you're up to date on your booster. This is really, really important for anyone who's over 60, anyone with underlying conditions, immunocompromised, and also for our health workers.
Thank you, Maria. And here is I'm just going to read out the comment from Divine Az, who is watching us from on Facebook. We are still feeling the impact of COVID-19. We need to live our lives as safely as possible. Thank you. Maria, maybe we can also go into variant update. Is Omicron still the most transmissible variant? And do we have any further updates on the XBB.1.5 subvariant?
So Omicron variant of concern is still the most transmissible variant to date, but right now there are more than 600 sublineages of Omicron that we're tracking. So the virus continues to evolve. XBB.1.5 is one of these. It's a recombinant of two BA.2 sublineages, which was XBB, and it's actually a further subvariant of XBB. We just published an updated risk assessment of this where we looked at its growth advantage, and it does have a growth advantage over other subvariants that are in circulation. We do not see a change in severity, but that data that we have to assess severity of XBB.1.5 is currently limited. There are about 9,000 or so sequences globally that are available for XBB.1.5. And we are tracking this in many different countries. Most of the sequences are from the US, but there are some from Europe as well, and some other countries as well. So we expect XBB.1.5 to increase in terms of its incidence. So we expect more people to be infected with this, and we are very carefully looking at severity. The one thing that we can say about this variant is it doesn't have a mutation that would necessarily mean or confer more severe disease, but we have to watch. Unfortunately, right now, globally, we're in a situation where as surveillance declines, as sequencing declines, the amount of information that our technical advisory group for virus evolution has to assess this is decreasing. It doesn't mean everyone around the world needs to be sequenced. We just need good geographic representation of the sequences around the world. We need studies to be done to evaluate each of these subvariants. But so far, yes, XBB.1.5 has a growth advantage. But in terms of severity, we don't see more or less severe disease compared to other sublineages of Omicron. But remember, Omicron can cause the full spectrum of disease, everything from asymptomatic infection all the way to severe disease and death. And your risk of severe disease increases if you are of older age, if you're over 60, if you are immunocompromised, if you have underlying conditions, and most importantly, if you're not vaccinated or if you have not received the full number of boosters. So please get vaccinated because our vaccines are incredibly safe and effective. And I know you did a recent Q&A with Kate O'Brien, who answered a lot of questions around that. And it's important that people understand that we are constantly assessing these vaccines. We're constantly assessing the diagnostics, the therapeutics, to make sure that the advice that we give is the right advice. If it could be refined, we will refine it and we will update that advice and issue it as quickly as possible.
Thank you so much, Maria. We are getting a question from Tonian Carrier watching us on LinkedIn. The question is about COVID and children. Do we have any latest information how it impacts children or how many children are getting infected?
So Omicron and COVID affects people of all ages. Children are susceptible to infection. They have been since the beginning. On average, children tend to have more mild disease compared to older adults, certainly compared to older adults, people who are in that at-risk category. But we do see the full spectrum of disease in children as well. And children have died from COVID-19. Every death from COVID-19 is absolutely tragic, but having a death among a child is just heartbreaking. So there's a lot that we can do to protect our children as well. And in some countries, they're vaccinating children as well. In some countries, children of certain ages are wearing masks, and children are going back to school. It's really critical that schools stay open and children receive the education and that security that they need. But all of us, the virus circulates in people, and children are susceptible as well.
Thank you so much, Maria. We are also having some questions about long COVID. How many people have been impacted, and do we know how to treat it?
So long COVID or post-COVID-19 condition is something that we are focused on. There are some estimates that maybe 10% of people who are infected with COVID will develop a post-COVID-19 condition. We're still learning this. This is just an estimate. We do see data that is coming out that suggests people have symptoms that are affecting many different organs of the body, the brain, the heart, the lungs, and really some debilitating effects, long-term effects. Many will recover after a year, but the bottom line is we don't have all the answers on long COVID. And I really hate giving that answer. I would love to be able to give a full, comprehensive answer, tell you everything that we can say about this, but it is something that we are learning. We need more research in this area. There are many groups that are out there that are studying this. There are papers that are coming out every day. Our clinical management group, our rehab group, many different groups within WHO are working together because long COVID affects many parts of the body. It's not just a quote unquote respiratory disease. It affects all of the organs, and we need to be planning for this. So we're working not only on the recognition within ICD codes for medical professionals, but we're looking at how do we develop the best clinical management and provide therapeutics for people who are suffering from post-COVID-19 condition. So it's a work in progress. But those of you who are out there who are suffering from this, there are many that are focused on this. We will not forget you. And this is not something that is a priority that is going to go away for WHO. So hang in there and fight as hard as you can. And we will as well for you.
Thank you so much, Maria. We are getting questions to specific patients group and COVID. And here is a question about COVID-19 among dialysis patients and its impact. From someone also watching us on LinkedIn. Do we have any information?
What's the question?
About dialysis patients and impact of COVID on these type of patients.
Well, I'm not a medical professional. My son likes to tease me all the time that I'm not a real doctor. I'm actually an epidemiologist and not a medical professional. We do know that there are certain groups that have underlying conditions that are impacted more than others, and people on dialysis, people with underlying conditions, tend to be more impacted in terms of having a higher risk of severe disease. I think what is important is that anyone who is infected with COVID, with SARS-CoV-2, anyone who develops COVID-19 needs to be provided the right clinical care in that clinical care pathway, wherever you show up in the course of your disease, whether it's acute infection, whether you've just been infected and you're dealing with the acute disease, or you are dealing with the post-COVID condition, whether it's 3 months after you've recovered or even longer from that. And that's what we want to ensure, that that pipeline, that pathway is solid, and that pathway within governments and within health facilities is strengthened. We don't want to see standalone systems dealing with COVID only. We want patients who show up at their healthcare professional at primary care or with specialists receive what the care that they need, depending on your exact situation.
Thank you so much, Maria. Sorry, we're getting very interesting questions and some are longer, so I'm trying to read them as well. Here's a question from someone who is watching us regularly. It's Minat Nian. I'm hoping that I'm pronouncing this well. Can you update us on the progress of the Global Pandemic Treaty? Will there be any major differences in terms of pandemic preparedness when we face another one in the future to come?
Oh, that's a great question. Every time you say when someone is watching us regularly, I think you're going to ask me a question from my sister who watches us regularly in the United States. With regards to the treaty, the discussions are ongoing. And so the answer to the question is I certainly hope so. I think the whole idea of this treaty or accord or whatever it's called or will be called is really a promise to do better by all member states, by everyone around the world. We've learned a lot from this the last 3 years, the last 3+ years. And that's learning from other outbreaks and other pandemics. We owe it to our children, our families, to the people who've died from COVID-19 to do better. And for me, I'm not part of the discussion, so I